Hi, I'm Ed Bacon, the Rector of All Saints Church, Pasadena. Whoever you are and wherever you find yourself on the journey of faith, I hope that you'll find something here that speaks to you. Welcome.
He's been here before. He's one of my favorite people. Pasadena right now is so blessed with very insightful, what I consider to be evolved public servants these days. And at the top of the list is Dr. Eric Walsh. He is the director of our public health department. He is seeing some of our intractable problems through the lens of public health, which is exactly, I think, the way God wants us to see it. So without any further ado, will you please warmly welcome Dr. Eric Walsh.
All right, we'll get right into this. So this is our 2012 Quality of Life Index. I just threw up a brief Old Testament scripture that I think helps me frame why I do what I do, and that is from Ezekiel 16:49. It says, "And look, this was the iniquity of your sister city. She and her daughters had pride, fullness of food, and abundance of idleness. Neither did she strengthen the hand of the poor and needy. And she was arrogant and did evil." And I say this, I lay this out because here Ezekiel is saying that there are three things that really upset God about this city. And part of this was actually Jerusalem itself. And that one was that they had pride. They had everything they needed plus. And at the same time, they didn't help the poor and the needy. They had time, money. They were very proud, but they never stopped to help the poor and the needy. The big what's as we go through our talk today are three. Our big what's are three, and one of them is poverty. We really are going to look at how poverty is manifesting itself in our city and in this area. We're going to also look at how racism manifests itself. We won't get through all of this today. We have 2 evening sessions where we're going to come back around to some of this. And the third big what is environmental justice. How have we built the environment around us to allow people to do well? And how does justice play out in that? So I start with a story from the 1936 Berlin Olympics. And this is the story of Jesse Owens and Luz Long. Jesse Owens, of course, came from the South. He traveled all the way to Germany to compete in the Olympics. And when Jesse Owens gets to the Olympics, of course, he finds what much of the world had found, that Hitler had already decided that there was a superior race, and that this superior race should outperform everyone else in the Olympics. So Jesse Owens finds himself where the Jews, of course, initially had pictures of rats placed on the front of German newspapers, and with the call that just like rats should be exterminated, Jews should be exterminated. Well, when African Americans or Africans came to Germany, there were pictures of apes on the fronts of the newspapers. And of course, Hitler was there when the trials were being done, the qualifying matches were being done, and Jesse Owens comes running down to do the long jump, and he's an amazing athlete, of course, but they cry fault as he jumps. He kind of says, okay, that's wrong, I know I didn't fault, but he goes back and he does it again, and the second time he's even more careful and they cry fault again. Well, this German, Luz Long, pulls him aside and says, you know what, if you take a white towel and put it just in front of the fault line, just enough in front of the fault line to make it clear, step on the towel and jump. Jesse Owens goes back the third time, comes flying down the runway, hits on the towel and sails. I mean, every time he jumped, there were oohs and ahs in the stadium because nobody had ever seen anybody run or jump like Jesse. He lands, he qualifies, he goes on to win multiple gold medals. He and Luz Long become very good friends, and you can see a picture of them there laying in the grass, much to the chagrin of the Fuhrer, who was angry, not only that he lost to Jesse Owens, but even more so that a German would be seen holding arm in arm with an African American walking around in the Olympic Stadium. The story really is interesting because Luz Long ends up losing his life as a Nazi soldier in World War II. He dies fighting for Germany. But Jesse Owens says that the most proud moment he has, and you can see them there on the podium accepting their medals, the most proud moment he had in the Olympics was not winning his gold medals. The most proud moment he had was walking in the stadium arm in arm with Luz Long. The story reminds us of what's really important. Life isn't about medals or about simple materialistic or worldly achievement. What matters far more to individuals is sometimes the relationships we build and the support we give one another. And that hopefully is what we get out of looking at some of the data we're going to look at today, because in my opinion, we really have a drowning culture, which means that we have to go upstream. And when we go upstream, we stop looking simply at individual health, individual population health. We stop looking at trying to get individuals to change their risk factors. But we as a society go way upstream, and we begin to look at what are the social and economic policies that actually allow for health. The same way that Luz Long said, you know what, you got to put a towel down before the mark and jump off of it to get where you're going. There are many in our society that need the towel placed for them so that there's a bit more fairness and accuracy in how they're looked upon in our society. And you can see, we look at neighborhoods and communities, living conditions, social relationships are critical. Another way to do this is the way the Canadian Public Health Group does it, and they actually mark this out so that you see individual lifestyle factors have much less of an impact than big things like general socioeconomic, cultural, and environmental conditions, and things like education, unemployment, the water quality, healthcare services, housing, the work environment, and whether or not people can get work. All of these things are bigger impacts on health long term than what that individual does. And as a medical doctor, we like to tell people, you should be doing exercise and eating fresh fruits and taking your medications. What we often don't see are those invisible barriers that block them from actually being healthy. Things that are impacting their health that sometimes they don't even know about. So we draw the picture like this. We ask everyone to look at the individual in this way. The individual has responsibility. There's no question about that. The question is, how hard is it for them to push the health burden up this gradient? And where we all come in is, how does society impact what angle or what slope this line is on? How do we change whether or not this is more of a flat trajectory, easier to push the health burden along, or if this is a more steep incline, making it more difficult for people to be healthy. And the difference between health outcomes in the country has a lot to do with how steep that incline is from one community to another community. So the Quality of Life Index was first done in 1992, updated in 98. We did one last year, 2011. So when you go online, you can look at the 2011 version. The 2012 version should be up again by the end of this week. But there's some things in the 2011 that aren't in 2012, so it's good to look at both of them if you go online. The audience is really for mainly professional, used for grant writing. To a lesser extent, we want people to help form policy issues out of it. And this is to gauge the social determinants of health in the local area. And it does cover Pasadena, and to a lesser extent, it does cover Altadena. So we get into what are some of the general health indicators? Well, one of the first ones is life expectancy. I start with the big one. And what you'll find in life expectancy, and this is not Pasadena, this is Los Angeles County, you'll find that on average, an Asian female is going to live to be 86.9 years of age in Los Angeles County. An African-American man is going to live to be 69.4 years. What you find then is that there is a huge disparity in life expectancy. And even if you say, okay, let's not use Asian women as the comparison, the fact of the matter is when you look across, you see there's a much shorter life expectancy for African-American men than for really any other group in the county. This has a lot to do, again, with the slope of the burden that they're pushing against. So we move forward. Let's look at the living wage. Let's look at poverty in our area. And this is more specific to Pasadena because these are our area codes. And this 91103 is the area code where the health department itself is. And it would compare then to 91105. And you can see just neighboring zip codes, there's a huge difference in income. In fact, anybody know what zip code this one is? I didn't know that when we first did this. I know now. And you can see there's a huge difference. Now, what does that mean? It doesn't mean that people who make more money aren't going to congregate together and have neighborhoods. It does say, however, that when you look at these differences in income levels, you are looking at individuals who are going to have a more steep gradient to push against. And there are a lot of things that I'm going to say that go all the way back to these facts of income levels later on. So in 2008 to 2010, the median income of Pasadena households was $64,692. 12% of households had income levels below $15,000 per year, while 17% had income over $150,000 per year. You can see that this is a big difference. And in Pasadena, let me just say, I don't care if you're a 0.5 of a person. $15,000 is not a lot of money to live on in this area. And anybody that's tried to rent or buy a home lately knows that that's just not a lot of money if you need to live in this immediate area. So we move into percent living below the poverty threshold by ethnic group. And when we move into this area, you find some interesting things. One of them, of course, is the percent living below the poverty threshold is higher for Hispanics and African Americans, but it's high for everyone, in my opinion. Here's 1 out of 10 people, and you can go across, and whether you're in the county or the city, 1 out of 10 people, at least in every group, is living below the federal poverty threshold guidelines. The problem, of course, is the federal poverty threshold guidelines are the same everywhere in the United States, but is the cost of living the same everywhere in the United States? So how much further would your $15,000 go if you live outside of Biloxi, Mississippi, than if you live in Pasadena? It goes a lot further, which tells you that our poverty, when we talk about poverty, our poverty is literally a poverty that's on steroids. It's much worse. And what this leads to is some of the things we'll talk about later. One of them is more families at risk of being homeless. Why is that? Because one person can't afford to rent a house. They're renting, if the house is 1,500 square feet and it's renting for, $2,000 a month, what happens in our area is that multiple families will move into the one house, which means one family for $400 or $500 or $600 a month might actually just get the garage, which probably doesn't have a real kitchen or real bathroom facilities. Yet those individuals are not classified as homeless. When we do the homeless count, which I'll talk about in a second, they're not classified such, yet they are without a home, right? So when we look at it, we start to see that there are complexities to the data that tell us there's a lot of work that we can do around each of these issues. The 2008-2010 American Community Survey estimated that an overall 13.7% of individuals within Pasadena are living below the poverty level, over 18,000 people, compared to 10% and 16.3% with individuals in Altadena and Los Angeles County, respectively. So there's a big difference in just the areas, number one, but obviously we have a burden of poverty that is significant. The National Health Interview Survey of 2009 reported about 65% of children in non-impoverished families were in excellent health. So how does this translate? 65% in non-impoverished families are in excellent health, compared to only 44% in poor families. Children in poor and near poor families were more likely to be uninsured, have unmet medical needs, and have delayed medical care. Here's the bullet that's important. Approximately 55% of the students in the Pasadena Unified School District live in households that are below the federal poverty guideline thresholds. 55%, a majority. Now, that's the straight federal poverty threshold guidelines. The problem even with that is what I said before. The fact of the matter is there are many families making more money than the federal poverty thresholds, families of four that make $45,000 a year, yet if they live in our school district are still living in significant poverty. So the number is actually an underestimation of what is actually going on locally, which leads us to employment. Well, when you start looking at employment, you find that we've seen some fluctuations. You see that the unemployment rate is better overall in the United States now than it was actually 4 years ago, which is kind of important. I can't say anything else except that, but that is important. And you can see Pasadena has had some real turbulent unemployment rates. In fact, the unemployment rate in the city has skyrocketed since 2000, more than doubling in Pasadena, in the city of Pasadena. Now, what we know, there's two layers to unemployment, like there are layers to poverty. The layers to unemployment go like this. If I was to break this out by race, what you would find is that by far, much higher unemployment rates exist for Hispanics, and even higher unemployment rates would exist for African Americans. In fact, in some studies, African Americans in the United States, where the average is around 8%, it'll be 18%. So much, much higher. For Hispanics, 15%. Much, much higher rates. But if you stop at just race and ethnicity, you miss where the meat is. The meat is, and I'm vegan, so it's soy meat there. Okay. So if you go down the next level, what you find is education is the big driver. So if you have a doctoral degree in the United States, your unemployment rate is below 2%. You have a college degree, it's below 5%, somewhere around 5%. Once you don't finish high school, it jumps to 18%. So if you really want to impact unemployment, one of the things that has to really be addressed is education. The problem is, in the United States, whenever, and let me back up. In California, every time something has to be cut, what seems to get cut first? Education. Now, I have to be quick because we have some more slides, but I gotta give you this one. The difference, in my opinion, and I may have said this the last time I was here, but the difference, in my opinion, of a developing nation and a developed nation isn't bridges, roads, and buildings. It's investment in people. People then build bridges, roads, and buildings. If the United States continues on its trajectory to defund education and healthcare, we will begin to move towards a developing country. And I am convinced, based on policies that are put out there are individuals in our country who would be happy to move America back into a developing country. The reason we have to fight the policies is because development isn't bricks and stones. Development is how we invest in people, and we are, as you can see, divesting out of people and into other things. Housing affordability then becomes critical. Well, in Pasadena, as you see here, 43% of the people, 43.4% of the people who own their housing and rent housing, and 40.1% of those who own their houses are paying more than 30% of their income towards just housing costs. That's relevant because every study says that you want that number to be below 30%. If it goes above that, especially into the 40% ranges, what happens is people don't have enough money to do other things. So other things are neglected, other things that are needed, things like doctor's appointments and the ability to buy food when you need to buy food. It actually increases the drag on poverty. So it shows that it leads to something else. And that means you will have a lot of people constantly at risk for homelessness. And I went out and actually did help with the count in 2010. It was quite fascinating. All the different places in town where people are homeless and kind of tucked away. But you can see it goes up and down. It's down in 2012. We think maybe because the economy has begun to pick up, also because the city has put some programs into place. But what we like to emphasize as the health department is it's still a lot cheaper to find supportive housing for individuals at $605 a month than it is to leave them homeless at $2,897 a month. I wish what I'm about to say wasn't true, but the fact of the matter, there are people who could care less about the people. The only thing that matters when they go to make policy is the dollars. So unfortunately in public health, we have to be able to make the argument that good public health actually saves money, because there are people who that matters more than the fact that we take people off of the streets. But you can see that there's a big difference there. The last bullet just talks about the fact that Project Housed and the bad weather shelter programs here in Pasadena, along with Passageways and Union Station, are really supporting the homeless. Project Housed is where we're taking the homeless people who are most at risk for dying in the next 2 years, and we're actually putting them in permanent housing. So far, if you talk to Bill Wong of our housing department, the program is really, really working well. So let's get into academic achievement in public education. And I've grown very fond of the Pasadena Unified School District. I think I was the principal of the day for Madison Elementary School, where Carmen is the principal, and I had an amazing time. I thought it was a fascinating experience with some of the best teachers anywhere, doing the best job they could with what they had. And I was really, really thoroughly impressed. But I learned some things kind of being there that is supported actually by some of our data. So when you look here, the Scholastic Aptitude Test, the SAT test that we all probably remember taking, you can see that Pasadena Unified School District underperforms. And I'm going to come back to why this might be the case in a minute. But you can see we underperform there. Well, you can also see from this slide that private school enrollment is a key driver in many of the things that are happening with the school district. And how is that? Well, you can see here that Altadena we've watched where in 2007 as many as 40% of the students eligible to be in PUSD were actually in private schools. That's dropped down to 30%. That has probably a lot to do with the recession. And you can see here that when you look at Pasadena, it's jumped up, but it's stayed pretty steadily at around 23%. What would be a more normal average? Look at Los Angeles Unified School District, 8.6%. So disproportionately, our school district is losing two things. Resources, because there are ADA monies that would follow those students into the school district. We're not getting those monies, number one. But number two, you're also losing some of the families that are most knowledgeable about how to navigate a school district and the educational system, those that would push for higher standards and qualities. Those people are being pulled out, which changes the environment. This is why diversity is important. Changes the environment of the school district. So this is a really significant thing. And what it means then is that we have very different levels of who's in school. So ethnically, you can see the school district is predominantly Hispanic. But what's relevant to me isn't even this ethnic breakdown, even though I wish there was more parity, because the fact of the matter is that this is not a representation of the population of the city or the cities that contribute to PUSD, right? The white population would be much higher, actually, if we look at the overall population. In fact, it would be probably the highest group if you took all three cities that contribute. But what I have here is important. The English language learning students for whom English is not their first language, account for 21% of PUSD students, or about 1 out of every 5 students. So when I was at this elementary school, what I learned was many of these children have a hard time in school because they're not just coming to school to learn, they're coming to school to learn English. Now, what the studies say is that if they have excellent Spanish skills, if they're Spanish speakers when they come to school, they do better when they have to learn English and then learn the basics that they're going to learn in those first few grades. But the same applies even for African American children. If the home language or the home English isn't the best English, when they come to school, it also is more challenging. So the school district has a challenge if many of the kids are challenged by language, whether it's a different language or if it's a language, or if their English is an English where when the teacher begins to speak, they're still trying to figure out some of what they're saying. So that poses a unique challenge. One of our council members was co-principal for the day with me at that school, and that was the school he went to. I won't say his name, but he's told me that when he came from Mexico to that school, he didn't know any English at all. And they had no special programs for him. He said he never caught up in school until high school. It took him his whole academic career at PUSD to catch up. The big challenge for them is they don't have the summer school programs that prepare the kids to go into school at those early ages to actually get them familiar with English and begin to build their language skills. So that's something that we have to look at. Educational attainment, we see here that in the city, however, this is a very educated city with 44%, 46% or more having a bachelor's degree or higher. But what we're watching and seeing is that high school graduates overall in the city decreased by 6%, and those with less than a high school diploma increased by 4%. So we see that there's a big change. I showed you this highlight the last time. I want to highlight it. This is relevant to health because when 35% or more of the people in a neighborhood do not have a high school diploma, you have more than a 2.5 times increased chance of being murdered in that neighborhood. Education is that critical to long-term health. So let's look at community safety and neighborhood engagement. That question was asked in the Human Services and Recreations in their needs assessment. And in Northwest Pasadena, they asked the question all over the city, but they asked how much of a problem is racism in Pasadena? In the Northwest, about 20% said it's not a problem, but almost a quarter said it is. When you go to other parts of town, and this is the rest of town asked different ways, the percentages are lower. And what we know about racism, and we'll talk about this one of the Thursday nights, is it doesn't have to be real. It simply has to be perceived. Once it's perceived, it raises the allostatic load of the person and actually increases stress. This changes even birth outcomes. Some of the most recent data is showing. And this is one of the reasons why African American women have babies that are born early and smaller more times than anybody else. This perception or this real racism. So we looked at crime to come into community safety, and we saw that homicide rates actually did tick up. Now, there are not a whole lot in Pasadena. Fortunately, there are cities like Chicago that are really dealing with some very high homicide rates right now. But there was an increase in 2011, the change from 2010 being about 50%. But we also saw a lot of economically driven crimes increase as well. So when we look at if education decreases crime Education is one of the best preventive measures we can have to help drive down and keep down crime rates. This is one of the things, and it increases employment and a lot of other things that helps to contribute to this. So access to health care. How many people are uninsured? You can see in United States, Pasadena and Altadena, we have a high percentage of individuals who are uninsured. The 18 to 64-year-old population being often the most challenging area to get to. And what we know with the Affordable Care Act is that it's going to help with a lot of this, but there are individuals who are not at all addressed. Those who are quote-unquote undocumented, I don't like that term, but they are not covered at all in the Act. We also know that even when the Act is rolled out, there are going to still be challenges because people are going to have to purchase insurance, some subsidized, some not. That's also going to be a challenge. So it's going to be interesting to see locally how we handle that. And you can see the California insurance coverage trends. Private insurance is coming down, while people are needing more and more public insurance or having no insurance at all. These are changes and challenges that we'll be facing as we move forward. Why is this relevant? Because we only have one hospital in Pasadena. Having only one hospital means that between 2002 and 2003, there was this massive jump in emergency room visits. Anybody know what happened between 2002 and 2003? St. Luke's Hospital closed. And when it closed, you had this jump in the number of people who went to Huntington Hospital. And one of the big challenges we have now, even as it's kind of gone up and down and made changes over time, is the hospital is expanding the ER. But if we don't do things to try and keep people out of the ER in the first place, you can't build an ER big enough when there's as many people live around here as they do. If you build it, they will come. One other interesting thing on access I wanted to point out is this, and that is that when you look at where medical providers are in the city, look at where they are. Now, we have a great clinic up here at CHAP. We have another big center here where St. Luke's used to be. But when you look at it, it's all in here. So the people who are up in these areas that are challenged for transportation really do need these services, because many of them walk to our site at the health department or to CHAP. So we need to make sure that these services survive, because when it comes to distribution in the city, it's not, again, the access just isn't the same. And of course, if you don't have transportation, if you have transportation, it doesn't matter so much. But when you have to catch multiple buses to get just down to get to the doctor's office, it makes it harder for people to actually get up and get to the doctor's office. The other thing that is important besides where we have medical clinics is health literacy, the ability to obtain, process, and understand basic health information services. 65% of respondents avoid the doctor because of difficulty with paperwork. And 95% of physicians believe low literacy adults experience lower quality of care. So we have a big thing that we have to do there. A couple other things I'm going to try and hit real quick. One of them is the number of births to teens age 15 to 19 in Pasadena by ethnicity. You can see that there's an uptick for Asians, a little downtick for blacks. Whites have gone up and down, but what we see where we see a steady highest rate, of course, is in our Hispanic teenage girls. So this is one of the places where we will look at what we can do to actually help to improve that. As it was last year, we noticed that in the 5th grade, 24% of kids in the 5th grade have tried alcohol in the PUSD. And this happens when they're left around at weddings or they're handed over because they're not finished. I was at one meeting and one of the church mothers, I was doing this to a group of pastors, and one of the church mothers said, yeah, I used to give my kids the rest of my drink when I was finished. And everybody in the room looked at her and said, oh, I found Jesus. I don't do that anymore. So you can look at where drugs are being used, and you can see there's a massive increase up into alcohol. And alcohol use as you go from 7th, 9th, 11th grade. The big one to me that we're going to have to address is marijuana. Marijuana use, there's a good study that came out that said if you use it after 18, it doesn't have the same long-term effects on the brain as if you use it before 18. When you use it before 18, it increases, one study said, lifelong risk of psychotic illness. So there's a lot of work we need to do there. And of course, there's the amotivational syndrome, a lot of things that we have to address. So we have a lot of work to do in the area of this. And the marijuana they smoke today is not Bob Marley's or Bob Dylan's marijuana. This is genetically engineered, much more potent, much higher levels of THC. So the work needs to really happen there. Physical fitness report grades, you see that PUSD kids outperform the county kids in 5th grade, but by 9th grade, the county kids drastically outperform the city kids. So we have a lot of work to do with physical fitness. Now, the same at Madison Elementary, we help fund Cal State Northridge to bring in kinesiology professor and students to increase the amount of physical activity they're getting. One of the things that's clear is that physical fitness and educational attainment or educational performance go hand in hand. So we have to get physical education back into the school system if we're going to do well. Last couple slides, I just want to say that at 16 years old, Barbara Johns took over her high school. She was frustrated at the lack of funding in her segregated school. This helped lead to the Brown versus Board of Education landmark trial that changed America. It was one young girl who actually had all the principals sent away and had students escort the teachers out of the high school, held a rally in the high school and said, we're going to change our school. She did not want desegregation. She wanted proper funding for her high school, which is actually profound. And here's what one of the biographers say about her. They say the case remained muffled in white consciousness, and the school child origins of the lawsuit were lost, as well on nearly all Negroes outside Prince Edward County. The idea that non-adults of any race might play a leading role in political events had simply failed to register on anyone, except perhaps the Klansmen who burned a cross in the John's Yard one night. I want to tell you that one of the things that we're going to have to do is empower our young people to do great things. That's something that's going to have to happen. We've got to get them a part of the conversation, and we've got to get them doing better. And I'll finish with this slide. I have more, but we'll do those on those Thursday nights. The four things that I think we really need to work to make sure our students have is good nutrition. So we're looking at breakfasts, programs in the schools that need to have healthy breakfasts, breakfast being the most important meal, the physical activity we just talked about, sleep. So if kids are living in houses where there's not enough space and families are doubled and tripled up, sleep becomes a problem and a place to study becomes a problem. You learn when you sleep. Your memories are formed in REM sleep, in deep stages of sleep. If you don't get to those deep stages of sleep, it's harder to remember, harder to focus in school the next day. And we've got to get the kids out of a survival mode and into a thrive mode. I told members of PUSD this week, some of the times when these kids are acting out, they're literally viewing even the teacher as a threat. Every other adult in their environment might be a threat. The teacher might be a threat. We need to find ways to move them out of that mode and into a place where they feel safe, not just at school, but they feel safe even in their homes and in their neighborhoods. Thank you.
Thank you, everyone, and thank you, Dr. Walsh. It's an honor to have you here today. Thank you for giving us your time, and it's a true blessing to have you working for the city of Pasadena. As Dr. Walsh mentioned, he will be with us 2 Thursdays, Thursday, November 1st, Thursday, November 8th in Sweetland Hall at 6:30 p.m. He's going to delve further into all of this information because I know it's a lot. There's a lot of data, but he's going to take us deeper with more time. So I hope that you all will take time out of your day to be with us. Again, Thursday, November 1st at 6:30 p.m. upstairs in Sweetland Hall, and Thursday, November 8th.